Fascinated by genetics but feel overwhelmed reading lots of articles? Check out our podcast, DNA Dialogues. It's the official podcast of the Journal of Genetic Counseling, where we chat with authors about their papers. We explore topics like the impact of rare disease on families, the intersection of the disability community and healthcare providers, prenatal genetic screening, whole genome sequencing, and so much more. From navigating complex testing decisions to building trust with diverse communities. Listen in as we unpack the science, challenge assumptions, and celebrate the human connection at the heart of genetic counseling research. DNA Dialogues, a podcast where the blueprint of life meets intimate human conversation. Search DNA Dialogues wherever you are listening to this podcast. Welcome to All Access DNA, the podcast where we explore genes and DNA to understand how they impact our daily lives. Whether you're curious about general concepts or want to dive deeper into the science of genetics, you've come to the right place. I'm Kate Wilson. I'm a certified licensed genetic counselor who has worked for clinics and labs in a variety of specialty areas. And I like to talk to smart people who can explain science in a way that is easy to understand. Whether you're a science newbie or someone just looking to impress people at parties with fun DNA facts, we've got you covered. Let's get started. Hey DNA, I'm Kate Wilson, and this is All Access DNA. In this episode, we are talking to Deanna Darnes, a certified genetic counselor and clinical trial specialist. We discuss how someone can get genetic testing, the barriers to having testing, and what access really means. We also chat about how pop culture doesn't reflect the reality of genetic testing. Thank you so much for being on the show today, Deanna.
Thank you so much for having me.
So first off, I wanted to know how you got into genetic counseling.
Oh man, it feels like such a long time ago now. So I started at UNM in 2003, which feels forever ago. And they had just changed their biology curriculum. So it was just a mess of a situation of their program. And their new program, it was basically like, if you go through it, you have to stay within that program. You couldn't switch up to the new one that they were doing. So it was kind of just a one and done shot. And during their genetics course, which was the second course you had to take, that's when I found out about genetic counseling. And it was basically just a very, very small sentence in the book. We, I think, touched on it a little bit in our lecture, and then it was never spoken about again. And so after I saw that sentence, I was a little bit curious. I looked it up online, or I got to NSGC site, found some genetic counselors in the Albuquerque area, met with two of them for a short while, kind of shadowed here and there. And then my senior year at UNM, I decided to do an independent study where I just shadowed or interned with the local genetic counselors for a whole semester. So I was with a metabolic genetic counselor, 2 prenatal, and 1 cancer. And so that's how I found out about genetic counseling. I got a amount of one-on-one information and shadowing detail to really understand what it was, not just a 60-minute deal. And I went from there.
Okay. Well, and it sounds like you were able to have some options or access to genetic counselors who you could chat with, learn from, find out more. Was there something that interested you about working in the field of genetic counseling?
Yeah, I really liked how much detail went into it. It wasn't like a typical hospital visit or a doctor's visit where you kind of chat with the doctor a little bit, you do whatever exam, like a well woman exam, or if you're there for ENT or a dentist or whatever. It was personal, it was in depth. You got into a lot of information. You were actually trying to figure out the problem rather than diagnose, checkbox, and then be on your way. So I liked that feel of it more so than, pursuing becoming a physician or something along those lines.
Got it. And we have another episode that I'll put in the show notes that's just about general what genetic counseling is, or why somebody might see a genetic counselor. One of the things that we wanted to talk about today is just only one reason why somebody would see a genetic counselor, which is genetic testing. So just because somebody goes to a genetic counseling appointment doesn't necessarily mean they're getting genetic testing, but that can be
Of
part of
course.
many of the appointments. So tell us a little bit about why somebody might have a genetic test.
So many, many reasons. They may have a genetic test because it was offered to them during their appointment with their doctor. So I did reproductive genetics. So I saw a lot of patients who had a physician or a nurse practitioner mention to them that they had this option. And so it was done. There were some instances where a person didn't know they had genetic testing done and it was just a box that was checked off. There were individuals who had a family history of a particular condition, and so they wanted to learn more about it and see if they needed testing for themselves, and therefore opted to do genetic testing for that reason. And then there were sometimes I had patients who saw something online or their favorite episode of Grey's Anatomy and
Hmm.
decided to ask some questions and wanted some further details and kind of found me that way.
Yeah, it's definitely more somewhat mainstream that people may have heard of genetic testing. So some people may not have been referred by a physician and may come because they heard about it elsewhere and are curious. So if that's how, they have genetic testing and there are a few different ways that they can get to seeing a genetic counselor. If somebody wants a genetic test, how do they get one?
Well, right now, vast majority of time it's through their physician. And so that's who is primarily offering them genetic testing, and that's how they're doing their blood work. But sometimes you can do it what we call DTC, or direct to consumer. So they can find something online, like previously, like labs like Invitae, where you could go have testing done directly, or things like 23andMe or Ancestry, and get testing directly themselves without a physician.
Hmm. And I know that some of them are DTC, like you said, direct to consumer. There's another terminology I've heard, CIT, or consumer initiated testing. So some of them, it sounds like the patient themselves or the person themselves can just go ahead and order it, send in the saliva. But then there's other ones where they might have a doctor or somebody, I guess, assist in the ordering process.
Yes, and so sometimes those are associated with like telehealth groups that you can talk to, and therefore they can guide you through the process and what lab you may be able to go to get your genetic testing and have a short consult with a physician or a nurse practitioner and go about it that way. So there
Okay.
are a couple of different avenues, but primarily the biggest one is going to be through your physician or healthcare provider.
In doing these genetic tests, we're trying to find out, like you said, there's a variety of reasons why somebody might need a genetic test or be offered a genetic test. And there seems like there's a variety of ways that they may get the genetic test. What are some things that make it, I guess, harder to get a genetic test or the challenges that could be there to being able to have the genetic test you want?
I think the biggest one is getting through the door, so to speak. So if your doctor brings it up to you that you have the option of genetic testing, because of course you don't know what you don't know. So if you never know anything about genetic testing, or you're not one of those who had a family history, or maybe something came up in blood work or was recommended to you, you don't know that you can have this option available to you. So a big, gateway is just having someone bring up that option to
Hmm.
you. The next logistics, where do you go? Does it have to be through your healthcare provider? If you want to get a test from 23andMe or Ancestry or something along those lines, where does it get sent to? I think a lot of us this past year have been having a lot of like mail issues. So getting, knowing where things can be sent, whether it's directly to your house or if you have a PO box or you're a military family, getting those kits to you if you do any type of direct to consumer testing can be difficult in itself. Where do you go for your blood draws? If you are at a clinic that maybe their phlebotomist or MA or nurse, maybe someone isn't there, or they have it set up that you go to a lab draw station, like whether that be LabCorp, Quest, or in Anytime Now, like various places that you can go. So there can be some difficulty there just getting to the place where you can have your sample taken. Those can be some difficulties as well.
And so some of the genetic tests are done on blood, some saliva, some may have to be done on one sample type versus another.
Correct. And so if you don't know which one or how stable that sample is, so getting it back to the lab, that can pose some difficulties as well. There were many times where I had patients who were doing different types of biochem testing, like Tay-Sachs or something along those lines. And I had a healthcare provider forget about sending the sample in, or it
Mm,
stayed over the weekend in the clinic instead of being sent out ASAP. And so now, of course, that sample is no longer being able to be used. So those logistic difficulties, if you don't know all of the requirements for what sample it is, when it needs to get back to the lab, how it needs to travel, does it need to be something that's on ice versus
hmm
dry ice, so on and so forth. So those are all things that can pose difficulties in getting your genetic testing done.
hmm So I guess that's part of the importance is if you're able to work with a provider or somebody that's ordering it, they should have access to sample requirements and how to get
Right.
samples in.
They should.
They should. Doesn't always work out. And I think one of the things too, you had mentioned, people might see something on TV, right, that prompts them to ask about a genetic test. I'm pretty sure I know the answer on this one, but genetic testing is typically not something that's done at your doctor's office or even sometimes in your hospital.
Correct. Very much so. Not done at the hospital that you're, getting something taken care of, like in the ER, and then they can do the genetic testing upstairs, or so on and so forth. And of course, for different genetic disorders, there could be specialized labs that it would go to. So maybe not even something in your city or in your state, but something that has to go elsewhere. So there are those difficulties there. And then a lot of people don't understand the time involved. So we're not getting it back in 60 minutes, or sometimes even a week. Chances are it's going to be somewhere between 2 and 4 weeks, or depending on the type of panel testing, it could be a lot longer than that as well.
So definitely longer than an hour long episode.
Right. Bailey is not going to be able to get her little interns to get you that information.
Gotcha. So you mentioned some of it with like the sample logistics. Are there other challenges in getting a genetic test or getting results back for a genetic test?
Well, when you say getting results back, that can always be difficult depending on how it's set up with your clinic. So if you're getting a fax report, and yes, some things are still faxed. So if your fax machine goes down or there's an issue there, sometimes you don't get your results as quickly. Or if you have a computer portal system that's not working, or if you had a system update with the hospital that's no longer compatible, so that can be an issue as well. Or if it's just a phone call and you're not there, or I don't know about you, but I've sometimes had to change my phone number. So if that number is no longer the same as what you gave to your clinic that you had the genetic testing to, that can be a difficulty in contacting someone to get them their results back.
hmm Yeah, and if since these are tests that might be going to like specialty labs, the results may be coming back different ways depending on who's performing the
Correct.
test.
Correct. Not everybody is the same.
And that also may be sometimes why it's hard to find either the orders or the results maybe in the clinic's like electronic health system. It's not always easily available there either.
Absolutely. Every EHR is different. I've been through quite a couple. I know people hate Epic. They think it's the worst thing ever. I've had worse EHRs than Epic, if that is possible. So Epic was never horrible to me because I saw worse. Um, so it depends there. But yes, it can be very difficult to see exactly where it is. It depends on who logged that information in. So if you don't know where to start, you don't know where to look,
hmm
or if it's not linked back accordingly, or it may be it goes to a doctor who is no longer at that practice anymore, or maybe somebody who's out on either leave or sabbatical, so on and so forth. So if you don't know exactly where those results are supposed to go, it can get very, very difficult to track if you're not on top of it.
hmm
And of course, that then delays getting those results back to the
hmm
patient.
Well, and I think it also makes the case too, like once you do get some results back, you definitely want a copy, like for your own records to keep so that you're not necessarily having to rely on phoning the doctor's office or trying to pull it out of like a patient portal somewhere.
Exactly.
Okay. One of the challenges that we haven't talked about that we hear mentioned a lot, whether we're a patient or a genetic counselor, is cost. So cost of genetic testing. I guess does insurance cover genetic testing, or is it seen more as an elective? And well, I'll pause there because I have several questions. So
Of
insurance,
course.
is insurance cover genetic testing?
Yes and no, but it depends on, of course, what type of insurance you have, your individual plan, how you have things set up. If there are any type of genetic testing exclusion clauses in your insurance, meaning they don't cover any type of genetic testing whatsoever, that's something that's kind of in the fine print that you have to be aware of. But if you are able to answer the question, yes, my insurance covers genetic testing, then you kind of have to dig a little bit deeper to see what type of genetic testing do they cover. For instance, if I am a prenatal patient and I want to have some carrier screening done, if I'm going through, let's say I have United Healthcare, they have a clause stating that if there's over 15 genes on a panel, they believe that that's not proven, or that's not, what's the correct term?
Experimental and
There it
investigational.
is. There it is. And you're kind of like, this gene has been known for 35 years. I don't think it's experimental.
Hmm.
But yes, so they think that it's not something that should be covered. So you have to kind of then see, clause A. What does A mean? Is it A-1? Is it A, going
Hmm.
digging deeper and deeper into your insurance policy? It's a yes and no question. It kind of depends on an individual level if it's going to be something that's covered or not. And then if it's not covered, why is it not covered? What are the workarounds? What are the loopholes? Is it because it's not covered through this particular lab? Because there are some insurance companies that have labs that they do partner with. And if your sample goes there, then it's covered. But if your sample goes someplace else, then it's not covered. So it's an out of network, in network sort of situation.
Hmm.
So
Hmm.
it can all be on an individual level. So unfortunately, it's not as simple. Does insurance, capital umbrella insurance, cover everything, or it's really just down to the individual person's plan?
Yeah, and I know we had another guest who talked a little bit about deductible. So saying, genetic testing may be something that is covered, but it may not. You may have to meet your deductible first to have that type of
Right.
coverage.
Or it's a big giant out of pocket until you meet that.
Right.
So yes, there's difficulties there. So again, it's that half in, half out situation
Hmm.
of, yes, it's covered, but these are the caveats to it being covered, and you have to
Hmm.
do this first. And if that's not fulfilled, then it's completely out of pocket, but yet at the same time still go towards your deductible, but
Hmm.
doesn't fulfill it just yet.
Hmm. And you mentioned that, some insurance companies may see certain genetic tests or maybe even genes as being experimental, or saying not enough is known, or we don't think this will make a difference. But some of this stuff has been around for quite some time. Do you have any insight as to why some genetic tests are still seen as investigational and not necessarily something needed to treat a patient?
I swear would ask myself this question every time I would have to go toe to toe with an insurance company, and I did so quite frequently, even to the point of like I worked with a person who would make the approvals on what would and wouldn't get covered, and even they sometimes would say, "I don't know."
Hmm.
They don't know what the internal politics are that makes something investigational versus something that is solid. So, for instance, we of course know there's well over 1,000 variants associated with cystic fibrosis, but yet if you have a panel that's over 15, could that or could that not be covered, even though we know that there's several out there and that they can all differ by ancestry as far as detection rates. So
Hmm.
it's things as simple as that. So essentially, you never know. It could be as different as who you're talking to that day, as far as whether or not something will get covered. It could be who was on the committee that year that decided what was going to get covered, what wasn't, what guidelines that they wanted to follow, which ones they didn't want to follow. It could be something that we will never have the answer to because that's all internal information, so we're not sure. So unfortunately, there's not a direct answer that I was ever able to get whenever I would do research for either individual patients or presentations that I would do on why something is deemed investigational if it's been around for years and years and has been proven to show that it helps when it comes to either making a solid yes or no diagnosis, or clearing up some medical management concerns or steering us in a better direction. There's really just not one answer that can cover everything.
And I think what I'm hearing too is that even if you're working with a physician or a genetic counselor, they might be able to give some insight or be able to maybe give supporting resources, paperwork on why something should be at least allowable by insurance, or insurance should consider some type of genetic test. But that there are many cases still where even then, even having a physician or genetic counselor looking at it and reviewing it, there still may be not much that can be done because it still may be unclear as to exactly why something is not deemed a covered benefit.
Correct. I always say the denial is kind of like the first door that you have to get through. So you have to send
Hmm.
everything in, get your denial, and then keep fighting and see exactly what it is. Because there are some times where it could just be a rubber stamp situation. There was some word that was in the lab's test requisition or in their synopsis that was a red flag for their AI system, and that's the reason why it was denied. But
Hmm.
then if you talk directly to a person and, reason out the situation and give them extra information, then it can be approved afterwards. Or it may be a series of locked doors that you have to get through. But there was never one magical number or word that you could say that automatically would get something covered. It
Hmm.
would just kind of depend.
Is that why you think there were quite a few people being interested in that, what you said, that direct to consumer DTC type of testing? Because that doesn't really go through insurance, right? People just pay out of pocket. So is that one of the reasons why people might do DTC testing?
I think so, as well as privacy.
Mm-hmm.
There are a lot of people who may feel, I don't know where this information is going to go or how long it's going to be attached to my medical record and who all can see it and how it can be used or not used against me. We, of course, have, the Genetic Information Non-Disclosure Act, but, not everybody knows exactly what that act does, what it protects, how the EOC works when it comes to, bolstering it and taking care of people if they feel like they have a claim. So they don't know exactly how they're protected. So it may also just be, I don't want to deal with the hassle of having to, go through a physician, go through insurance. I don't even know if I would act a certain way or differently as far as with this information. So maybe I just want to find out for myself and then figure it out from there without having too many cooks in the kitchen. That
Mm-hmm.
could be a possibility as well.
Okay. So maybe cost, but maybe privacy, some other things. I think, and maybe one thing to kind of back up and highlight, if you're able to speak about it, is what are kind of some of the differences or the reasons, not the reasons because we just talked about that, but the differences, I guess, between a direct to consumer test versus a test that your physician or genetic counselor may order.
We're going to have to be a little bit more specific with that question, Kate. Are we talking differences in like methodology of testing? Because that could be different. Through your physician, maybe they would recommend a test that had full sequence analysis. So looking at the gene as a whole, looking just maybe for small missing or added pieces to the gene, so deletions and duplications. Or is it just straight up genotyping where they're just looking for specific known variants and that's all it does?
Mm,
So there could be some differences there. We hit on a little bit how big a panel is. So maybe through a DTC, it's going to be a bit smaller of a panel, maybe not, 256 different
hmm.
genes that we're looking at, maybe something smaller like 10 or 50. So there could be some differences there. As of course you well know, for certain genetic disorders, there could be multiple different genes that are associated. So maybe some
Hmm.
tests will only look at a couple, and then some will look at all of them that are associated with the disorder. So it can vary immensely.
So not all genetic tests are equal. They don't all look for the same
Do the same
things.
things.
Yeah,
No.
they don't. So, and I guess that is one of the considerations too, is that some of the direct to consumer may be affordable because they may not be looking for all the
As in
things.
depth. Hmm.
I see. Okay. Oh, and I guess that leads me into the next question is, so when someone is doing a genetic test, I come back not, not to put these shows in the spotlight or say they did anything wrong because they're certainly entertaining. But like, watching some of those shows and it's sort of like everything's fine when you get a test result back.
Right. What is everything?
What is everything, and what exactly is a genetic test going to be able to tell somebody, or what can it not tell
Well, I always stay away from the word everything because there's no test that has that ability. There's not
them?
one panel of testing or one way of looking at genes that can tell you absolutely everything that could be different about that gene. So there's not one single test that does all of those things. It really depends on what your focus is, so what you're looking for. So if you're looking for just one particular disorder, if you're looking, let's say, just at sickle cell, we know we can test, just for that, and that's going to tell us just about sickle cell. If you're an individual who is going through IVF and you're wanting to do some pre-implantation genetic testing, unfortunately, yes, I saw it a lot that it said, well, the testing came back negative, so everything's fine.
Mhm.
It can't possibly cover everything. While, yes, I may be able to tell you about things like a trisomy, so having an extra chromosome, so your Down syndrome, your trisomy 18, your trisomy 13, that test isn't going to tell me everything about maybe possible seizure disorders that happen when you're an adult. It's not going to cover everything. So it's not, there's no test that can look for every type of possible genetic disorder or every disorder that has maybe a susceptibility gene, so
Mm-hmm.
maybe closely associated with it, or really predict the future. I think I
Mm-hmm.
had a lot of families who thought that genetic testing could tell them, oh, okay, well, if we reach age 10 and there's nothing that's come up by now, nothing could possibly happen down the road after that. If we've reached age 50 and nothing has come up by now, nothing could possibly happen. And that's just not the way it works.
Mm-hmm. Mm-hmm. And part of that is, I mean, one, we just don't know all the genes and what they do, so we can't really look for those. But
Right,
it is impossible to test for everything all at once because there's still a lot of things that happen that have nothing to do with genetics. So I guess
right.
it can be reassuring to kind of cross off some common things or the things that you're at risk for or concerned you might be at risk for.
Right. And it doesn't necessarily tell us severity either. So I
Yeah.
think that's another big thing that people want to know. Well, how bad is it going to be if I
Mm,
have this condition? And everybody's different. There could be other modifier genes that are at play. Again, other susceptibility genes at play. Your environment, where you're raised, what you're exposed to, all of those things are intertwined and intermingle.
mhm.
So we can't tell you. It's not a crystal ball. Essentially, is what I'm getting at.
Mhm.
Genetic testing is just not a crystal ball.
Yeah. Yeah, it's not a Gattaca where we go to the ATM machine and we get our printout.
Yep, exactly. You went on a first date, you get your lips
Yes.
swiped, you want to know all about the individual that you were just intimate with,
Yes.
and we won't have all of that information. So no.
Yeah, yeah. Well, I guess, there are some areas that are sort of complex and maybe challenging to understand about genetic testing. So for a person who's thinking about it, considering it, or maybe did it and has results but still has questions, what do you tell your patients or are there resources you point them towards to try to get more information?
Sure. So, of course, it depends on what type of result we got back.
Yeah.
So, did we get a positive result so we know what's going on? Did we get a negative result so we don't know just yet and we need to do maybe some further genetic testing or wait a little while until, technology can catch up with us? Did we get a variant of unknown significance so we don't know exactly where we need to go? So, it kind of depends on going from there. So, let's say we got a positive result. We know we have this diagnosis, so next steps, of course, would be, finding a specialist that specializes in that condition so that we can get them partnered or seen by that type of healthcare provider. So they would have further information there. Big advocate for support groups, finding things online, putting families in touch with other families or individuals that are going through the same thing so that they have another touchstone. Reliable sources, whether there's websites that are dedicated to that condition, again, support groups, that type of information, so that they can have that moving forward on things to follow back to, because of course they're not going to always remember everything said during a genetic counseling session. So that type of information would be the next step if we got a positive result. If we got a negative result, next steps would be, okay, we've crossed maybe that condition off the list.
Mhm.
It may be a situation where we need to then meet annually or every 5 years, or depending on whatever your clinic's recommendations are for follow up, to see if any type of new symptoms arise, if certain things progress, if certain things get better, so that we can have a better idea of where we maybe need to go next as far as genetic testing or what um, we need to kind of hone in on. If there is a variant where we're not sure what it means, that of course means that I've got to do a lot of research. I've got to start looking to see if there, what, studies have been published, who has talked about this gene or this variant in particular before, where has it been seen, what groups of individuals, if there's any information to be gleaned there. Sometimes talking to people at the lab, trying to get them to connect me with maybe other clinics that have had patients that have been referred and had genetic testing there, so I can talk maybe with them about what their patients are going through and what information they can tell me, looking for different support groups, to see if there's other people that have similar findings. And so maybe that then can tell me what further information I need to give the patient. So it's usually, no matter which way, which result you get, just more fact finding that you're going forward and just giving the patient the information that you find along the way.
Mhm. Mhm. And again, another case to working either with a physician, genetic counselor directly or with a lab that has something available to provide some of those additional resources. We talked about a few different things that impact access to genetic testing, like awareness or education, cost, insurance coverage. I noticed that one of the things that's very popular today in the genetics, I guess, business of healthcare is talking about access, 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 increasing access. So access is a bunch of different things. It's not necessarily just one thing that's going to solve this. So what are some areas that you think are important to focus on, I guess, to say to get the right genetic test to the right patient that needs it?
Right. And I wish it was a one size fits all situation
Hmm.
because it really is sort of battling a war on multiple fronts. So you have, your social media and all the adverts that pop up, of course, depending on your algorithm.
Hmm.
You're going that way. You're going through, healthcare providers, so your physicians, your nurses, gynecologists, different specialists that you're talking with. Um, Podcasts like what we're
Hmm.
doing now and trying to get the word out that way, talking to labs directly, their directors, employers, and telling them about the genetic counseling experience and genetic testing and what their patients and possible patients may go through and how to make access easier. But unfortunately, there's not just one way to reach someone.
Hmm.
Unfortunately, the biggest difficulty or barrier that I see when it comes to, you know, gaining access to genetic testing is something that I said in the beginning, which is just the knowledge of it. It's not like going to a dentist. We all know why we go at least once a year, if we can, to see
Hmm.
the dentist and get the teeth cleanings and why that's important. And that's really something that's drilled into us when we're a child. We learn about, what that means and what annual visits mean and all that type of stuff if we are privileged to do so. And so one of the hills that I will always die on is that genetic testing and access won't be as ubiquitous or easy to get to until you're educating people essentially in childhood
Hmm.
and specialists when they're in their training. When it comes to medical schools, they get such little information
Hmm.
about genetic testing, and depending on what program you go to, their curriculum is now becoming more integrated. So they'll, during their different blocks, they may learn about it, a genetic disease as it pertains to a cardiac block that they're learning, or an ENT block that they're learning, or behavioral sciences, so on and so forth. And so it may be a small part of that block of study, but it may be something that they don't get tested on. Or
Hmm.
if during their step exams, I believe it's only 5 to 9% of their step one exam is based on genetics. So even from that standpoint, it's just not looked at as important. And
Hmm.
so until we get to a place where it is important, or it's something that we, talk about or teach kids, and so that they're aware of it even growing up, that hey, this is something that's available to me, it's always going to be an uphill battle because there's not one correct way to reach someone. Because
Hmm.
again, we've got social media, we've got podcasts, we've got movies, we've got TV shows. It's a part of our culture and our lexicon to talk about genetic testing. If you listen to murder podcasts, girly, if you are into those, if you love a good Netflix documentary, uh, there at some point they always bring up DNA and that testing. And of course you and I very vividly remember the OJ Simpson trial,
Hmm.
and everything, and anything that Nancy Grace touched, we
Yes.
learned about that as well. And she always had some expert who would talk about DNA. So we're at a point of saturation now where there's probably not individuals who don't know what genetic testing is, as on a macro level. They know that what it
Hmm.
is, they just don't know what it can do for them.
Hmm.
And so
Hmm.
that's where the focus needs to be on, is what does it do for you? And I really feel like you can't do that essentially with adults. You can do that, with children, and knowing that that's something that's available and getting at that level. Otherwise, it's something that, yeah, we heard on a podcast. It's
Hmm.
something that maybe I came across in a news article, or, when a
Hmm.
big celebrity gets diagnosed with something and they happen to have genetic testing, then we may, read about it then. It may spark our interest.
Hmm.
But if you don't have that touchstone to say, what does this mean for me and why should I do it? Then it's almost like you can have this tornado of information, but if it doesn't touch down and get you,
Hmm.
it doesn't mean anything.
Hmm. I think it's a weird, I don't know if dichotomy is the right word, but it's interesting how it seems very ubiquitous. I think a lot of people have at least heard the term DNA, right? Like you said, there's kind of a lot of things out there in popular media, but also there's this focus too on precision medicine, treating diseases, specifically medications. I come from the cancer background, so we work a lot on that, and this push to do it. But while it may be out there, a lot of people still either are not able to get it, or like you said, just don't even have the awareness of what's available, how it's available. So it's one of those things where it's talked about a lot. And I think a lot of people think there's a lot more DNA genetic testing that everyone is having, but that's not necessarily the case. There's still a lot more work to do to just increase people's knowledge about genetics.
Right. And it also depends on what they're being told. So you may have someone who's very curious and may go to their healthcare provider and say, "Hey, I want to learn more about this. I'm concerned for X, Y, and Z in the family history, or I saw this on TV and I want to know more information about it." If they get a healthcare provider who's like, "Oh, that doesn't pertain to you.
Right.
Oh, that's not a big deal." Well, how much are you going to, keep knocking at that door? Well, I am actually really interested. Or,
Mhm.
depending on why you're seeing a doctor, you don't go to a doctor unless something's wrong or unless you want, to fix something. So there may be a short amount of time that you have with that healthcare provider to talk about your concerns. And if that's just something maybe you're bringing up towards the end because you're
Mm.
curious about it, that may not be, a garden that's getting tended to. So you're not
Right.
talking with them in a lot of detail about it. Or they're not getting talked to in a lot of detail about it because maybe that physician doesn't think it's a big deal. So that's a big issue as well, of who is the first person that you're getting to talk to openly and how long about
Mhm.
this curiosity.
Mhm. And to physicians really even understand the information and what can be done for the patient by finding out some of this information. So I think, it may not necessarily say, "Hey, here's a medicine that we can give them," but there's a lot of other benefits from doing genetic testing for people.
Right. And also, how do you pose the follow-up question? So you may have someone who maybe is curious about, cancer in their family history, and, you go over that scenario and you find out maybe, those individuals were, very, very older diagnoses and may not be something that's compatible with a recommendation for genetic testing for cancer. But that should also then open the door to say, well, let's talk about other things that could be going on in the family history and other reasons why someone should get genetic testing. So it depends on how even open ended those discussions are.
Mm.
Because if I'm only, raising the flag about cancer, but yet you never talk to me about, early infant death or something else that went on in the family history, or that never gets taken, then you don't get to go down those roads either.
Mhm. Right. So a lot of it too is it kind of a closed, I call it like a cul-de-sac conversation, or are there other avenues being open? And like you said, sometimes even a complete family history isn't being taken. I think, you go to the intake sheets and they have a couple of highlighted questions, but it's not that they sit there and ask a lot of detailed follow-up about some of those.
Right. You get very, very focused on the purpose of the session. So
Mhm.
if you're
Mhm.
in, cancer genetics, you're only talking about cancer things. You're not talking about, oh, maybe this cardiovascular concern, or maybe this concern for dementia, or again, early infant death, or the other things that could be going on. So
Mhm.
sometimes, again, you don't get that wide overarching conversation.
Mhm.
It gets very targeted very quickly.
And we talked about a few different things kind of throughout the conversation. I think there's definitely importance on knowledge, education, having healthcare providers be more aware and integrating kind of genetic testing or genetic healthcare into their practices. If we look back at all the things that you talked about, is there anything specific that you would want people to remember about the conversation? So saying, we had a 30-minute conversation. If they just walk away, they can only recall one thing. What would you hope that they remember?
No goodness. I would say that, unfortunately, until we get to a place where, of course, genetic testing is taught more, like I said, in childhood or in your teen years and your early 20 somethings, about what the importance is of genetic testing as it's tailored to you, that you still have to be a very strong advocate for yourself in
Mm,
the healthcare community. You have to keep asking the follow up questions or digging a little bit deeper, or if there's something that piques your interest, going online and finding a genetic counselor in your area that you're able to talk to and have the ability to maybe, have a telehealth consult, so you don't have to, make the drive into a clinic, or if, especially if there's not one near you, that you at least can, email or give someone a phone call to answer those questions. So if anything, if you're curious about something, keep digging. And
mhm,
so don't let that curiosity just peter out just because maybe someone didn't go deeper for you. You have to keep moving.
mhm. Be your own advocate. And then I think maybe hand in hand is if you're a healthcare provider, the takeaway is listening to your patients and realizing that the issue with access could be different for everybody. So there's not just one size fits all answer into offering genetic testing to your patient.
Right. And also always looking for the secondary questions. So
Mm.
again, talking about the family history, just because you've answered one question doesn't mean that there couldn't be others that you need to answer as well. So being open to saying, I've answered this question, but there are other areas in which genetic testing may be for you. Would you like to explore some of those avenues as well?
Mm-hmm. Perfect. Thank you so much for being here today, Deanna. I appreciated your time and for you explaining some ins and outs with genetic testing for us.
Thank you so much for having me. I really appreciate it. It was a great conversation.
For more information about this episode, visit allaccessdna.podbean.com, where you can also stream all episodes of the show. This link is also in the show notes for easy access. Any inquiries on the podcast can be sent to allaccessdna@gmail.com. Check out our Patreon at patreon.com/allaccessdna and consider donating to get bonus content, submit questions for our guests, and connect with other genetic curious individuals. Note that this podcast is for entertainment and education and is not intended to be a substitute for professional medical advice. Please consult your physician with any questions you may have regarding your health. Please rate and review the podcast on Apple, Spotify, or wherever you listen. This helps other people like you discover the show. All Access DNA is hosted, produced, and edited by Kate Wilson. The logo design is by Designs by NKJ. Thanks for listening and join us next time.